Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
IVC Filter. Introduction. IVC stands for Inferior Vena Cava. It is a large vein that runs through the middle of the abdomen. IVC filters are wire devices that can be placed in the vein. The filter traps large blood clot fragments. It prevents them from traveling through the IVC to the heart and lungs where they could cause severe problems. This program explains the IVC filter. It discusses the benefits of the device as well as potential risks. Blood and blood vessels. The circulatory system is made up of the heart, blood, and blood vessels of the body. The heart pumps blood that is rich in oxygen to the body. The blood travels through the arteries. The arteries become smaller, tiny vessels called capillaries. These carry the blood into the body tissue and cells. Blood then flows into veins. The veins carry the blood back to the heart. The inferior vena cava, or IVC, is a large vein that is located in the abdomen. Blood from your lower body returns to your heart through the IVC. Deep vein thrombosis, or DVT, is a blood clot in a vein. This condition can affect men and women of any age and race. Deep vein thrombosis is caused by slow blood flow. It is also caused by other factors that increase the tendency of blood to clot in the body. Most vein clots happen in the leg veins, but they can happen in other parts of the body. Blood clots that happen in the legs or pelvis sometimes break up. If a clot in a vein breaks off and travels through your bloodstream, it can lodge in your lung. This is called a pulmonary embolism. Pulmonary embolism is a serious condition that can cause death. Sitting for a long period of time can increase your risk of deep vein clots. Low blood flow in a deep vein due to injury or surgery can also increase the risk of deep vein clots. Having an inherited medical condition that causes increased risk for clotting is another risk factor. IVC Filter. Usually people who are at risk for blood clots take blood thinning medications to prevent clots, but this treatment is not recommended for all people. An IVC filter is used when you cannot take medications to thin your blood. It may also be used if you are taking blood thinners and you continue to develop blood clots. An IVC filter can prevent blood clots from moving from the vein in your legs to the lung. The IVC filter catches clots as they try to move through the body to the lungs. This treatment will prevent a pulmonary embolism, but it will not stop you from developing more clots. An IVC filter may be the right treatment for you if you are immobile or have a history of blood clots in the legs, been diagnosed with deep vein thrombosis, recently had a baby, recently had surgery.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Before the procedure. Before the procedure, your healthcare provider will perform a physical exam to check your general health. He or she will ask you questions about your personal and family medical history. Your healthcare provider may test your blood. He or she will check how well your kidneys are functioning and if your blood is clotting normally. Tell your healthcare provider about all of the medications you are taking. Tell him or her about any allergies you may have, especially to anesthesia. If you are on blood thinning medications, you will not need to stop taking them before the procedure. Eat a small meal the night before your procedure. After midnight, do not eat or drink anything. You may be allowed to drink clear liquids on the day of your procedure. You may be asked to remove some or all of your clothes and wear a gown during the procedure. Do not wear jewelry, eyeglasses, or any metal objects. Plan to have a family member or relative drive you home after the procedure. Procedure. Placing the filter may be done as an outpatient procedure. You may not need to stay at a healthcare facility overnight. Placing an IVC filter usually takes about an hour. You will lie on your back on a table. During the procedure, you may be connected to monitors that check your blood pressure, heart rate, pulse. A healthcare provider will insert an intravenous or IV line into a vein in your hand or arm. Sedative medication will be given, or you may receive general anesthesia. The area of your body where a catheter will be inserted is shaved and sterilized. The catheter is usually inserted into a large vein in your neck or groin. Using image guidance, a catheter is inserted into the vein. It is moved to the IVC in the abdomen. The IVC filter is then placed through the catheter into the vein. Once it is in the right place, a doctor will release the filter. The filter will expand and attach itself to the walls of the blood vessel. Once the source of your arrhythmia is detected by the electrodes, electrical energy will be sent to the area. How does the energy restore a regular heartbeat? Choose one of the following options. 1. By scarring the area. 2. By jolting the heart. At the end of the procedure, the catheter will be removed. The opening in the skin will be covered with a dressing. No sutures are needed. Risks and complications. Placing the IVC filter in your body is safe. Major complications are rare. You need to know about them just in case they happen. By being informed, you can help your healthcare provider detect problems early. Some risks include those related to anesthesia and any type of surgery. Risks of general anesthesia include nausea, vomiting, urine retention, cut lips, chipped teeth, sore throat, headache. More serious risks of anesthesia include heart attack, stroke, pneumonia. Your anesthesiologist will discuss these risks with you. He or she will ask if you are allergic to certain medications. Other general risks include allergic reaction to dye used for imaging, exposure to X-ray radiation. Complications after the IVC filter is placed in your body can happen if the filter fills with blood clots, moves, breaks. Blood vessels, nerves, or organs in the body along the route of the catheter may be injured. This is rare, but it could be life-threatening. Most people do not have symptoms if the filter fills with blood clots, but some people experience leg swelling. This can be serious. If the filter moves slightly, it is usually not a problem. Rarely the filter may move to a place where it is dangerous for it to be, such as the heart. Other risks of the procedure include infection, damage to blood vessels, bruising or bleeding. After the procedure. After your IVC filter is inserted, you should be able to resume your normal activities in 24 hours. Until then, do not drink alcohol, drive a car, make important decisions, sign legal documents. If your filter was placed through a vein in your groin, do not lift heavy objects or climb upstairs for 48 hours. Contact a healthcare provider immediately if you have a high fever, dizziness, new chest pain, severe bleeding, shortness of breath, vomiting. Some IVC filters are left in the body permanently. Others are placed temporarily. They can be removed if they are no longer needed. To remove an IVC filter, a catheter is inserted into a vein in the neck or groin. It attaches to a small hook or knob on the end of the filter and pulls it through the catheter and out of the body. Sometimes IVC filters attach to the vein through scarring. They cannot be removed. In this case, they are left in the body permanently.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. IVC filters are wire devices that can be placed in the vein. The filter traps large blood clot fragments. It prevents them from traveling through the IVC to the heart and lungs where they could cause severe problems. Usually, people who are at risk for blood clots take blood thinning medications to prevent clots, but this treatment is not recommended for all people. An IVC filter is used when you cannot take medications to thin your blood. It may also be used if you are taking blood thinners and you continue to develop blood clots. Placing the IVC filter in your body is safe. Major complications are rare. You need to know about them just in case they happen. By being informed, you can help your healthcare provider detect problems early. Some IVC filters are left in the body permanently. Others are placed temporarily. They can be removed if they are no longer needed.
Thank you for using Explain.